So, before I get into my opponent's arguments, I wanted to introduce a topic that they did not bring up, which would be a huge disadvantage if we had a single-payer healthcare system, and that would be the wait times and the increase of wait times if we did have a single-payer healthcare system. For example, here in the United States, we have a relatively low wait time already compared to countries that already have a single-payer healthcare system. For example, Joshua W. Axine, who is a FSA FCA MAAA, stated that the American system in place has a waiting time from general practitioner to specialist of 20 days. So people would only be waiting an average of 20 days to go from general practitioner to a specialist. While in Canada, who has a single-payer healthcare system, are waiting 20 weeks. So as you can see, with a single-payer healthcare system, that would cause increased wait times. Going along with that, Lanhee J. Chen, who has a PhD out of Stanford in 2020, stated that the demand for medical care would probably exceed the supply of care, which would increase the wait times for appointments or surgeries, greater wait times at doctor's offices or other medical facilities. So with a single-payer healthcare system, that would increase the wait time due to demand. And then going along with a increased wait time, that could cause other issues with urgency and possibility to even wait at all. Again, Joshua W. Axine stated that it could lead to avoidable days in the hospital, or it could lead to undesirable outcomes. And then going along with undesirable outcomes, Joshua also stated that it could lead to things such as longer recoveries or disabilities, or things even like death. If someone had to wait longer than they could or longer than they thought they could. So that would be a main issue with a single-payer healthcare system. And then going into what my opponent said, which would be advantages to a single-payer healthcare system, the first one that they stated was that a healthcare is a human right. If you are sick or hurt, that you have the right to get you should have the right to get health care. And that's totally true, because already in place, if you are sick or in an emergency or like giving birth or having a heart attack or like got shot or something, if you go into a public hospital, they will not deny you health care just because you have because you don't have insurance. And if they do, that's a whole other legal issue going on, but they will not deny you health care if it is an emergency. And then also going along with the human rights, it also is a human right to have a personal choice of which healthcare that you're receiving, which doctors you're going to, which hospitals you're going to, which offices you're going to. And with a single-payer healthcare system, you would get that all taken away. And then also going along with that, it would cause inappropriate government outreach. For example, Linda J. Bloomberg, who has a PhD out of 2019, stated that universal health care represents inappropriate government outreach into citizens' lives, health care, and health insurance industry practices, and employees' rights to choose what coverage they want to offer their employees. So with a single-payer healthcare system, that would implement and take away personal choice and implement more of a government input, when that is the opposite of what the primary thing is here in the United States. The second argument that my opponent brought up was that it would decrease the healthcare costs. And then my first response to that is again by Linda J. Bloomberg, who has a PhD out of 2019, stated that universal health care would require healthy people to pay for the medical needs of unhealthy people who they don't even know. So things like through taxes, which would cause increased taxes, again by Linda J. Bloomberg, said that it would increase the taxes tremendously by 3 times what people are already paying just to pay for other people's healthcare for things that they don't even need. And then lastly, my opponent stated it improves patient care. And this ties into my argument in the beginning of this video, because it goes along with the wait times and the increased waiting and leading to things maybe like death. So would a single-payer healthcare system really improve patient care if it could lead to death over something super small just because of wait times?